Hello, everyone. Thank you for joining in today. Saturday, somewhere in the world, almost Sunday. Could be Sunday somewhere in the world as well. Yeah, I appreciate you taking the time to join me in the regular schedule with our moving to Ghana series. And check in, let me know who you are, where you're watching from, and then we can put in some questions as well. Um, if you have any questions regards to real estate in Ghana, you can visit us at our website at royalconsultingsolutions.com, and we can take it from there. Okay. So healthcare, right? Healthcare is a big deal. Um, it's something that you have to make personally because only you know your health situations, and so that is one of those things that you can't rely on somebody else to tell you what is the best healthcare for you because some people may need specialized care that will require some expertise and and resources. And for most people, it's just going to be routine check up and maybe treating some few illnesses and there. And so we discussed about the visit. And one of the episodes we discussed about a visit is when you visit, kind of one of the things I want you to look at also is the cost of good healthcare and how you'll be able to deal with medical emergencies and the cost and then the distance from where you want to stay to the hospital. So today I'm going to be talking about public healthcare in Ghana versus private healthcare. I'm also going to talk about mental health facilities in Ghana, how we treat mental health, and that kind of stuff. And so then I'm also going to talk about prescription drugs and pharmacies in Ghana. And then I'm going to wrap it up with travel for treatment, why some people leave the continent for specialized treatment in other parts of the world. Okay, so we start with the public healthcare system in Ghana. I think there's a national healthcare insurance called NHIS that most people tap into for the general public per se. Um, I don't think everybody has that insurance card because some people never sign up for it. And so that is how Medicare is administered through that system. But you have to understand too, that varies from different regions. So let's say, if you're in Accra, you may have access to certain amenities at a hospital. Then if you're in a remote region, in somewhere in Ghana. So granted, you still have the insurance card, the treatment and the resources over there will be different. So you must factor that in. Another thing too is that we must factor that not all um, medical facilities accept the NHIS, that's the National Health Insurance Scheme. So not all the public, especially the private hospitals, do not accept them, and so you have to factor that in. And many treatments are not always covered by the public insurance. So it's geared towards local treatment like malaria, diarrhea, respiratory diseases, some diabetes, and hypertension and others, right? So if you have specialized care or something complicated, they'll probably your insurance is not going to cover that. The NHIS is not going to cover that. Now, so even though most people, now that people have the public health insurance, they begin to access, formal health care for either prescriptions or clinical visits and other things. You still have out-of-pocket expenses, which is more than what most people can still afford. Like I said, so it's not like just because you have the public health care, you can just go in and then you're gonna get treated for everything. It's very, very limited to the scope of what it covers, and also they are out-of-pocket expenses. Now, one thing you also have to factor into is that emergency services in hospitals are available within the cities, but few exist outside urban areas, right? So you have to factor in where you're gonna live, how close to the major hospital, and that kind of stuff. Because if you are remote, you went for remote for peace of mind, and something happens, and you need to be rushed to the hospital. Chances are it will take some time to get there. So people in urban areas tend to rely mostly on African medicine, traditional medicine, as an option, especially people in the rural areas, because sometimes they cannot afford to do this long travel distance, right? And so let me give a few shout outs. Leslie, thanks for joining us. Akusia, always good to see you. Eve, thank you. Haja, good to see you. We talk about healthcare. Takisha, thank you. Good to see you, sis. Talking about healthcare. So I'm talking about the private healthcare in Ghana. And after that, I'm going to go to, no, I'm talking about the public now. After that, I'm going to go into the private one. And so sometimes there's also a mentality that some locals actually believe that the prescription drugs that are given are substandard or even ineffective compared to the traditional African medicine. So that is also mindset around that. But doctors operating in the public services in terms of providing care, on average, you can have one doctor to 15,000 patients, right? So sometimes there's a waiting period, to be treated because the doctor is sometimes is just stretched beyond thing, so they can't cover. On average, there are about 1,800 or slightly more public hospitals in Ghana. These facilities sometimes can be overcrowded and lack the quality, obviously, in those advanced countries. And even within those public hospitals, there's variance in terms of, um, like, quality of equipment and quality of care, and stuff like that. So, like, for example, if you look at the GhanaHospital.org website, it states that we only have 14 eye clinics in Ghana, 17 ultrasound scanning facilities, and out of that, only 8 diagnostic centers and some services are not provided in every hospital, right? And so, for example, only 9 hospitals provide surgical services, 5 of which actually are specialized in the field. So you may have to, depending on what conditions you have, you may have to find a couple of hospitals ahead of time in which you can decide, okay, this is the condition I have. So if anything happens, I know I can go to hospital A, right? Or hospital B. So you must know that because I've seen situations happen, people will be taken to another hospital and then they cannot handle that emergency. And then some people are transported and on the way being transported, they lose their life. So just prepare. That's all it is. Now, if you believe in vaccines, okay, get all your immunizations done before you move. And if you don't believe in them, that's fine too, right? And so, but on average, expats or people that have lived abroad or visiting and stuff like that, in Ghana usually use private facilities, which offer a much more considerable higher standard of treatment and also has some modern medical facilities capabilities, right? So that is the private ones. The public one is a little bit cheaper, but also there's a wait time, and you're gonna pay out of pocket, which will be expensive, and then you're not gonna get all the various range of services. It's very limited in scope wise what they are willing to do. Okay, so that's the public one. Private care. So private care in Ghana is absolutely a must, but it depends on the finances, right? I can say everybody can afford it. I think they should utilize more of their private care, because you get access to quality care and also treatment. Okay, and and also there's a lot of reduction in waiting times, and also the medical quality is good, and especially if you have to deal with emergencies, private care becomes the best option to be able, to do that. So because on average they provide a better standard of treatment, with more modern facilities than the general public, the public hospitals, right? But even that also too is like within the private hospitals also there is also um, variance in terms of quality of the facilities and equipment, because some of the private care is very more robust like a hospital, and sometimes some of the private care facilities looks like some mini clinic somewhere, and so it's all about homework and knowing anything happens which one to use and access to. And also, a lot of the private care facilities also the staffs are much comfortable. Okay, they're usually fluent in English and that kind of stuff. So, communication is very, very important when you need to relay critical information, right? So you get that. Ghana is a cash and carry, right? It's a cash and carry country. So basically, you bring cash for your to treat to get that care. Um, and so I have a question here. It says, let me give you a few shout outs here. So greeting, Tomadashi. Thank you, bro. I hope all is well. Um, yes, yes, Luca is one of the best. Yeah, Lester is another one of them. So it's good. It's good. So and then I'll come back to this. You're diabetic. So diabetic, they might treat it depending on what stage it is in the public healthcare, but I can say you probably want to, if you're on insulin or whatever you are using to mitigate your sugar level, just make sure you bring your stuff and also try to use the private uh, hospitals if possible. Okay. Now I'll tackle. I'll go into deep now. I'll tackle some of the questions here. So cash and carry, right? So and then one thing I want all of us to consider is international health insurance, right? I always do this whenever I travel. International health insurance. Sometimes your employer, if you're remote in Ghana, your employer might have that option, in which basically it helps, especially for serious medical conditions or sometimes emergencies, serious emergencies, and then evacuation. So look into that and see if you can sign up to make sure that because sometimes people do need to get evacuated, and if you have that, that really really helps, right? I think the coverage, the one that I got a couple of months ago, I think the coverage was like I think for evacuation is like $50,000, right? And then they can cover everything up to 200,000 or something like 250,000. So look into that. Look into that aspect as a backup. Okay. So private healthcare means access to quality facilities, right? Yahoo Clinic is also one of the good hospitals, right? So on average, it's about 1,300 private facilities, which are providing better quality treatment and they have more modern equipment than the public institutions. And so you have to really, really, uh, deal with these questions, right? So expat healthcare insurance is very, very important that we need to look at, because you might need emergency medical attention or even an equation. So look into that. Make sure you are covered for any kind of things. And also, I would say take a visit, pay the consultation fees. I know sometimes there's private cares facilities ask for consultation. Do them. I think they're charging $85 to $100 or something like that. I would say just do them and get you ready, prepared to go there and live your life. Now I see a question about so you put a question about the prescription medications, right? So here's my thought on this. Okay, for me, when you live here, for example, you have a medical history of what could kill you and what can cause some minor problems and what is acceptable. And so if you have some prescription, I would say, continue or stock yourself for that duration. And obviously, storage becomes important. They want to be storing them in the heat, and you have that kind of stuff. And so the other question is, can you bring your prescription from the West? Yes, you can, but also you have to be careful because so bring your prescription, bring the generic names of your medication, but certain drugs to make sure they are legal in Ghana. For example, there are certain restrictions around sleeping pills and medication for ADHD and some strong painkillers for which you need a medical certificate. So if you are taking something on this like severe opioid and that kind of medications, I would suggest you have your provider or work with your doctor to give you some medical certificate, which shows that you actually, so not just the prescription bottles, but you have that medical certificate showing that actually you need these medications, right? So that you don't get into a situation, it looks like you are trying to be get into pharmaceutical street pharmaceutical sales, right? So make sure you have all these things. So create your list of the generic drugs. You need to ensure that you can access them. And usually, the international private medical insurance provider will be able to help you with this as well. So I hope that answered that. Now, yes, so they will. So that I can like answer that one from that. And also too, um, I would say start working with some of these private medical providers to see if they do accept, um, you know, medical insurance coverages from outside the country. The big ones like Aetna, Blue Cross, and those things to make sure if they do accept those. And then talk to your provider to make sure if you need to maybe fill out some paperwork and get you all the stuff that you need to be ready. Should anything happens, you're ready to go. Emergencies are not time to be trying new things, right? So get yourself ready. We are gonna get sick. Hopefully, nothing serious, but sometimes these things do okay. And stuff. Anti-malaria medicine is available throughout Ghana. But I would say if you have something used for you that is very effective, bring it. Because um, you know, you might have something over there that might have side effects. Personally, I can speak on that, right? Another thing you also must be careful also too, like when we talk about the pharmacy, right? So there's about what 550 pharmacies in Ghana, which most in the major cities and towns. Some do open 24 hours, but you also have to factor this thing I'm about to say. Okay, is there a serious concern about some pharmacies selling fake or low quality drugs and medication? So ensure that you purchase any medication from a pharmacy attached to a reputable medical facility, right? And then also make sure the pharmacy alliances to dispense prescription drugs, and so you need to check into that they've been approved by the Ghana Pharmacy Council, right? So you have to look at in these things. Um, okay. Now another thing that really really drug dealing street pharmacy. Yes, yes, yes. And so okay, let me see if there's any questions here. All right. All right. I'll talk about the big one, mental health. If if you are if you grew up in Ghana, if you grew up in Ghana and you are genuine, you will notice that when we grew up, mental health was treated with a huge stigma, huge. And it's only up to 2012 that Ghana really, really proposed the Mental Health Act, right? Prior to that, there was no any organization. There was not anybody briefing the government with mental health, how to deal with mental health. And the budget that was allocated for mental health was literally 1.4% of the total governmental health expenditures. So it's abysmal, right? And so around 2013, mental disorders, start being covering as insurance schemes, right? Prior to that, you put you in asylum, and sometimes they're saying to some prayer camp and say you are possessed with something. We've seen that, we've seen that, and like somebody said, they said you possessed. That's true. We saw that. We know people that went into that. And so, but now, mental health care is affecting all of us on the continent, outside the continent. I know our people don't want to deal with this. It's a big deal. And so you have to look into that and make sure the medications you have that is working for you, you bring them because it's still new to Ghana. It's still very new in terms of how we are going to deal with it. And to be honest, there's not a lot of adequate mental health facilities that also have the training and the skills to be able to deal with it from here. Because, like I said, other countries have been doing this for decades, so they understand these things. But it's only up onto 2013 that we started getting serious. And so the stigma is there, the discrimination from individual, family, work, employment, education to health level, right? It's still there. Because anytime somebody goes through a mental crisis, it's attributed to some superstition. And but sometimes I probably think 95% of it is not even superstition, but it's just the mindset, right? So, but it is growing. I think society is beginning to see that. And so a number of organizations are beginning to tackle the mental health stigma. And so they've created a mental health society of Ghana. You can reach out to them. But I'll say whatever um, that whatever medication you need, whatever therapies you are needing, and all that kind of stuff, meeting your psychologist and psychiatrist and all those things, keep all those things. They do have some to some extent in Ghana, but they are mostly also in the city, right? Mostly, the largest cities will have your therapists, mental health facilities, including the psychologists, therapists, and psychiatrists. So if you're in some rural places, it might be difficult. Okay. Yes, the stigma is true, like I just said, is still even here. And that makes it difficult, for people to actually, seek the help that you need. Strong people can break down. Life is hard, things happen. We all have our weak moment. And so if you need to sort something out. And so then you can increase you know, your quality of life. That is what it's about. There's no shame if you are going through anything. There's no shame in that. Okay? Yes, they do have them. Yes, they do have them. I know a few people, but it's new, and it will take time. And so travel for treatment. So this is one of the things that sometimes happens. So remember, earlier I mentioned international health insurances because that's going to basically reduce some of the cost, right? Because they do have a flight arrangement with other carriers to should a need become necessary, they can fly you out to seek some specialized care and that kind of stuff. So I think you should look into all that stuff. And then one also things too, like sometimes like people from the continent, when we go back, sometimes listen, our immune system has changed so much that there's certain things that the locals are resilient in because that is the environment. The body has been able to adapt and mitigate and create immune responses to certain illness that we cannot. Those uh, antigens will be foreign to us, right? So we will not be able to deal with some of this stuff. So sometimes when we go there, it's whole a different thing. And so I hope if this makes sense for you, because factor that in. So once you're prepared, gonna be awesome for you. And if you're not prepared, just like in life, anything, if you're not prepared, then things don't go according to plan. So just take care of your physical health, your mental health, your emotional health, your spiritual health. All that makes you enjoy the quality of life. And so the work needs to be done before you go. If you are taking some medication, it's working for you, please do not go there and somebody make you a concoction and you throw that thing away. And then, because the concussion might work, it might not work, and everybody's different. It might work for people, it might not work for you. And you put it in your body, and you don't know all the stuff that's in it, then you start having some other issues. Okay, and so avoid drinking tap water. For me, yes, anytime I drink the water in Ghana, um, I get problems. So I just buy bottled water and stuff. So I use bottled water for cooking. It looks like it's getting a little bit better, but it's just I just use bottled water. Some people are able to do it, but not me. It's difficult sometimes to gauge to gauge what is in the water, whether the treatment regimen is being applied. And so, if you want to guarantee anything, then you probably want to have your own water and set up your own filtration system, and then deal with that. I mean, you could never know. And also think like within certain part of the country, the water may be cleaner than others, but you never know, you know, and that kind of stuff. So let me know if you have questions regarding the healthcare aspect, building, what to look for, how to plan this trip. I think I'll cover this aspect because I think medical care is very, I put it as probably the most important thing. If you don't have good health, everything else um, it almost sometimes doesn't really matter, you know. And so concussion, yes, we have yeah, it's that is yeah, yeah. I will go to a private to check it because there's a lot of things that can give you headache. And so y- it's interesting because in the general public facility, almost everything is malaria, and so and it's interesting. Ghanaians trying to everybody's a doctor over there. Everybody's a healthcare provider, so people usually make their own concoction and they drink it. I think just check. Sometimes just check. And sometimes it's just the money aspect. People don't want to go pay 500, 600 cedis to go get a consultation, and sometimes so people do go and they say nothing. They say last time I went, they didn't find anything. So obviously, there's no reason to go. Um, Buying food off the streets, even though the best food are on the streets, mostly I can see from my experience, probably 90% of the food, the street food are good. But you also have to look at the hygienic conditions um, as well. You have to look at it. And so I try to avoid some of the salad on the streets, because I've had bad experiences with that. So I'll eat salad at a restaurant, or if I bring it home and I make sure it's clean, very, very well. Okay, because one time I had a bad experience that took me out for 3 days. So I learned my lesson. Yeah, food poisoning could happen. Okay. Yes, I do the same thing, Leslie. I stay with warm and hot food, preferably fresh. Stuff like that. Yeah, so I believe the new malaria medicine is something to consider. It's out now. It's about 50% effective. So GlaxoSmith something. They are the manufacturer. They've been working on it for a couple of years now. And so yeah, that's one way to consider. Malaria still kill about 260,000 people in West Africa every year. And so, granted, most people do survive it. It does also kill people. And so, do not be using your body for pilot test. And somebody may survive, and somebody won't. Okay, so the medical decision is just personal. It's you. You have to do the research and decide what is best for you and what you need to take. Because everybody has their health history and their family health history. So, and when I go to Ghana, people are bringing me concoction. I don't take them. I really don't know what is in it. Okay, so I don't take this stuff. Um, yeah, 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 yeah. I eat. When I go to Ghana, I probably eat mm, about 70, 75% of all my food intake are street food. Um, I just avoid the salad. I'm good. Yeah, yeah. You don't want to see where the food is prepared. Sometimes you not eat it because but it's very delicious. I don't know. I don't know. Usually, you start with adult, and then children and babies are the last. Stuff like that because um, that is how usually things are tested, right? No, nobody wants to use the children first. So, but we'll see. But I'm thinking about 5 years. They'll come up with something. And some people do take the risk. They will take they'll boil a neem tree, and drink, to deal with that, stuff like that. But for me, it's like if you go to Ghana, you have 3 weeks, and then malaria knocks you down for 3 or 4 days. That could be like days that you miss that you can't really get something done. You know. So, against the COVID vaccine, that topic is like World War III, right? Yeah, 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 it's like like I said, is people have to come to their own conclusion, right? Yeah, they have to come to their own conclusion. And there's risks in anything. A lot of things can kill you. So it's just the way it is. You know. Okay. So let's see. Um, let's few more questions, and then we're gonna wrap it up. So that's the healthcare questions for you. Look deep. Start doing some research. When you visit a couple of places, and know where you need to be for some care and that kind of stuff. Start getting some cost. And so in the budget, the financial budget that I spoke of, I also talk about emergency and healthcare related that need to be considered because I think here we have some copay, we have some deductible, stuff like that. So I think for most of us, we should be saving some money to do private. I think the private will be the best option for us. Um, but sometimes we live far away from these facilities, and so we can access them. But I think that would be the best option to deal with any medical emergencies and even things like checkup and that kind of stuff. And so once you've done that, and if you need some care, that you can schedule visits to come here every year. to take care of it, then you do it. It's just it's all about being smart, right? A lot of people have died over some unnecessary attitudes and behaviors, you know. So anyway, let me give a few shout out before I wrap it up. Of course, you are Leslie. Thank you, Eve, for 41K. Thank you for tuning in. Takrisha always, Hajia, Tomodachi, Holmes. Appreciate you tuning in. And so that will be, wrapped up. I don't want to make it too long in the series. Um, Hopefully, the other things about land search, how to buy land and the building series and all those things, are being helpful and stuff. That is, this could be, like hospital specific and what network they are participating in, what agreement they have with other uh, um, big insurance, healthcare insurance companies. And so that'll be specific. And also you want to make sure it's updated. So let's say you ask this company, do you guys accept coverage from Aetna or Blue Cross and stuff? They say yes. And I think next year you're going to a trip, you want to make sure that information is also current, right? And so different hospital have some kind of different arrangement. I know when you have the international coverage, what they do is that they already work with domestic healthcare facilities. So if anything happens, that is where you go, and they will help facilitate with your medevac if that is needed. So it's not like you're gonna go to some village and they actually give you a number you can call, and so and preferably have somebody have access to this thing. That anything happens, they call this number, they give you the policy number, and then when you travel, when you stay in there, give them the time frame and that kind of stuff. And so it's about pre-planning this ahead of time so that whenever something happens, you guys know what to do, because time might become a factor into whether you're able to get the care you need. Okay, subscribe, like, share the videos. If it's very informative, take what you need. If we offer consultations, building, starting a business in Ghana, buying land, how you gonna protect yourself, even buying a house, what you need to do to protect yourself, and to look at the laws, how you can do that. You can visit us at our website, okay, Royal Consulting Solutions, and then you can send us a question. Okay. And so thank you, right? A consultation is a math. So just do your homework. Do your homework, you'll be fine. That's all it is. And that's why. So if you and most of you already doing that anyway, and so it's just being preparing for you to go there, and because every time that you are sick, it's taken away from you enjoying the life that you deserve and you should have. Okay. Somebody say don't mind if I take too long. So I hope that makes sense. I hope that makes sense. And if it doesn't make sense, make it make sense, right? All right. So thank you everyone for tuning in. Check out our Bravo podcast um, that we have Wednesdays and Fridays. We address different topics with great panelists. You get exciting sometimes, you get a little bit passionate, but it's all good. And so let me know how I can help you. It's why I'm on YouTube. Okay. So anyway, thank you. Have a great day, and then enjoy your life, and then also plan for the future and stuff like that. So you can just every 5 years. The goal is every 5 years you should get an upgrade. Your life should move better every 5 years. So that's the plan. Every 5 years, upgrade. You know, it should be better. That is the way it should be. So my goal is to just help you just sort out some few things that I've learned along the way. All right. Thank you. I appreciate all of you, and have a great weekend.